Her numbers are questionable. A lot of them, she's pulling them out of the air. I'm from online. We use different words there. The main thing is this is a huge change in the way we get health care. It's a great first step. It is not the best solution. I was an advocate for single payer, much prefer that. Twila and other Tea Party members were shrieking about death panels and socialism. And
they say this law is a huge step in the right direction. Do the negatives of this bill actually outweigh all those positives that you see?
I do think so, Heidi, that the negatives do outweigh the positives. I think when you look at that, one of the things that you have to remember is that coverage does not equal care. And so when we look at where the health care bill is going, we look at things like what are happening or what's happening now. There's 800,000 people that have lost their coverage because Principal decided to stop health care insurance as a result of the law. There are 2.4 million people who have gotten waivers from Obamacare because they couldn't afford it. And as we look forward, we look at the possibility that the cost of health insurance for individuals will go up $2,100. And this is something that the CBO and the President agree with. So we are looking at sharp increases in cost, and we're looking at decreases in access, decreases in insurance. And, even with the children, your comment about the children, there are 19 states where there are no longer child-only policies. Child-only policies were really inexpensive. Now it's very expensive to add your young adult onto the adult's policy. So we have had a real loss there.
All right. Well, Eric, I want to give you a chance because I see you laughing over there.
Her numbers are questionable. A lot of them, she's pulling them out of the air. I'm from online. We use different words there. The main thing is this is a huge change in the way we get health care. It's a great first step. It is not the best solution. I was an advocate for single payer, much prefer that. Twila and other Tea Party members were shrieking about death panels and socialism. And
well, Eric, do me a favor, respond to the list, if you would, because I want to give you an equal opportunity here, as I did Twila, about those three specific, if you would, sort of objectives of healthcare reform. You see them in front of you there that we discussed. What do you think specifically about those three items?
They make sense, don't they? You shouldn't injure or harm children. I mean, this is common sense stuff. One thing that you didn't list, which I think is very important, is called the medical loss ratio provision, which makes sure that the health insurance industry actually has to put a large percentage of the profit they make to actual health care, instead of paying Bill McGuire or whoever their multiple billions per year to deny health care for kids or whatever they do.
Well, Twila, what are your thoughts about the trickle-down effect, if you would, for every American as we look at all of these intricacies of healthcare reform?
Well, first of all, just to clarify, I'm not pulling numbers out of the air. I'm actually pulling them out of CBO reports and the Federal Register.
It's called cherry picking.
And all of those kind of information sources that we all rely on. The other thing about medical loss ratio, which should be mentioned, is that 7 states have asked for a waiver from the medical loss ratio requirements because they were worried about destabilizing the market. So when you look at the trickle-down effect, as you were asking about, I think what we're looking at is a time where there will be less choices for everyone. The costs will be higher. The government will be making more decisions. The government gets to decide what essential benefits are for all of us. We all are supposed to buy our health insurance in an exchange where there's only 4 types of policies: bronze, silver, gold, and platinum. And the Secretary of Health and Human Services gets to decide who gets to sell insurance, not only what you have to buy, but who gets to sell it. So what we're looking at is a lot of control here over our healthcare decisions and extra costs that we aren't paying today.
Eric, what are the numbers that you have? You say that Twila's numbers are wrong. She says she's quoting the Congressional Budget Office. You have different numbers. What are they?
She cherry picks the numbers from the Congressional
What are your numbers?
Listen, I don't have the numbers at my fingertips, but what I know is what the CBO said on numerous occasions, that this is going to save a huge amount of money towards our national debt. The numbers are huge. I don't remember what they are. I mean, I've been focused on tracking Michelle Bachmann because my usual guy who writes about her is out of state. So I've been swamped on that. The bottom line is she's cherry-picking her numbers. She has a long history of doing this. I've checked into her background, and there's a lot of numbers she's cherry-picking, making up, and...
All right, I'm going to give you each 10 seconds to sum up the last year of health care reform. Twila, you first.
First of all, the Medicare actuary actually said that this is not going to save money. So I think the last year of health care is a showdown between the states and the Obamacare, or the Obama administration, and we would like the states to be winning. So far it seems like states are going to be moving towards doing Obamacare because they are worried, and that's unfortunate. We need to wait for the U.S. Supreme Court judgment to come.
Okay, thanks. Well, Eric, last word.
The bottom line is that if we would have had single payer, if that would have been part of a discussion, if we would have been discussing the public option, that would have saved a lot more money. Costs are still going up because the health insurance industry is still in control of our health care.
All right, to the both of you tonight, we certainly do appreciate your time. Eric Pusey and Twila Brase.
Thank you so much.